Hello, my name is Davina Fankhauser. I'm the founder of Fertility Within Reach, and it is my pleasure to be the moderator for the session on restoring health to optimize fertility. I'd like to thank the sponsors of our session today is HRC Fertility and Lotus Center for Integrative Medicine. And I want to thank you for coming and participating, and we hope you will continue the conversation and ask your questions with Facebook and Twitter. There's a hashtag FPLA14. Pretty simple. So we hope you'll participate, and we'll be answering some of those questions that come in through social media toward the end of this session. This is a session on how the integration of assisted reproductive techniques and classical Chinese medicine provide a complete and complementary approach to your reproductive health. And this is actually a topic I deeply believe in because I was an infertility patient and I did 6 IVF cycles, 3 before the introduction of Chinese medicine and acupuncture, and I was a poor responder and I did not have pregnancies. And then I did 3 IVF cycles while I was doing acupuncture and introduced to Chinese medicine, and I had 3 successful. I doubled my production in follicles and had successful pregnancies. So this is a topic that I hope everybody learns about. So for more information about our speakers and the other sessions, you can find those at www.fertilityplanit.com. So today our panelists, our speakers, we have Dr. Jeffrey Nelson, and he is with HRC Fertility. He's one of those very special doctors where he's contributed a significant amount to the science of infertility through his research and his experience. But he's also that doctor that identifies each patient as an individual and strategizes with each of you what's the best way to help you build your family. And I actually was invited to their clinic, and it's in Pasadena. It's a beautiful office. Thank you for having me.
You're welcome.
There. And our other panelist, our expert, is Andrea Thorpe. Andrea is a licensed acupuncturist. She's also a reproductive specialist in that she has her master's in acupuncture. However, she also has a 3-year fellowship in gynecology and reproductive health, and had fellowships in London and in China. And she's come to the States. She's been practicing for 20 years, and she's a PhD candidate. And the one thing I can say, she's board certified in Oriental reproductive medicine. So we're just thrilled to have you both with us. Thank you very much.
Thank you. We just wanted to, in the brief time we have, just talk about what we think are the benefits of integrating 2 different medical modalities, an Eastern approach and a Western approach. And the Western approach being the contemporary use of assisted reproductive techniques or therapies in combination with Eastern techniques, which is classical Chinese medicine, because we think that the combination of 2 things are synergistic and they really optimize overall reproductive health, and therefore are going to optimize clinical outcomes and better chance. It's going to better chance for conception during people undergoing infertility treatments. And so our premise is just really the combination of the 2 things being synergistic, improving reproductive health. And so thank you for the introduction, by the way. That was very sweet. So, but again, my name is Dr. Jeffrey Nelson. I'm from Huntington Reproductive Center. We call ourselves HRC Fertility as well. And we're celebrating our 25th, well, actually last year we celebrated our 25th anniversary. So this is our 26th year. We have grown to become, we're the largest deliverer of reproductive care on the West Coast. And our offices kind of span from Westlake Village down to the northern part of San Diego County. I'm the longest standing physician that's been there. I joined the practice in 1992, and I'm in our Pasadena office, the original office. And so a little bit about how this topic kind of came to being. I did my fellowship in reproductive endocrinology at Pennsylvania Hospital in Philadelphia, so I was on the East Coast. And I had not really been exposed much to Eastern or Chinese medicine until I came out here. And so, to be honest, and to be very frank, when I was exposed to it, it just seemed kind of odd to me because diagnostic decisions and therapeutic treatments were being determined on, palpating pulses and looking at people's tongues. And that wasn't stuff that I was trained in. So it just seemed, like I say, kind of odd. And so, but having an open mind, I had met several practitioners, and I watched the process and saw that really in a variety of medical modalities, not just reproductive medicine, they were having a lot of success. And so what I did to integrate it into my practice, I was very cautious about that. I really just started doing it to patients that really essentially were desperate. And they were patients who were, had really horrible ovarian reserve and had a very difficult time stimulating their ovaries with IVF. And I just felt like it couldn't hurt. And we were desperate, so we tried. And I saw a lot of clinical benefits as a consequence of integrating the two techniques. And so that's sort of, we really just have different focuses. We have different diagnostic and treatment modalities. But on our own, on each individual thing, Eastern and Western, we've had a lot of successes. And so the key thing is the combination of the two things, I think, is powerful and synergistic and optimizes overall reproductive health. So that's how this all came to being. And so what I want to do is talk about, and hopefully this will, great. I want to talk about really sort of the Western, the kind of traditional or contemporary use of assisted reproductive technologies. And so this is just kind of an overall idea about the components of fertility. So we have to have people with nice, healthy ovaries that have an abundance of good quality eggs, the ovarian reserve in the upper left corner. During the month, a whole wave of follicles, a cohort of follicles, the egg containers, start to grow and develop, which is follicular recruitment. Eventually, one follicle becomes a dominant follicle, and as it grows and becomes the one with a mature egg to ovulate, the follicle is producing estrogen, which is in turn stimulating the lining of the uterus, endometrial development. Eventually, ovulation occurs. Egg gets released. Hopefully, the couple have intercourse at the appropriate time, and sperm travel their way through the uterus and tube and meet up with the egg in the end of the tube and fertilize it. Embryo that forms in the end of the tube has to travel through the fallopian tube for about 4 or 5 days, getting nurtured by the tube till it makes it into the uterus and then finds a place to implant. And that's kind of just the whole process in general. Now, from a Western standpoint, at least I approach it, we kind of take the reproductive system and break it down into components. And we then look at those components, we assess them. Based upon our assessment, we make a diagnosis. And based upon our diagnosis, we then determine what the individualized therapy is going to be. And in general, this is for all patients undergoing fertility. I tell all my patients there's 5 factors that are required that need to work well to enhance the chance of getting pregnant. And so, number 1, you have to have nice, normal, abundant sperm. You have to have a healthy uterus within which embryos can grow and develop, so uterine factor. Fallopian tubes have to be open and functioning appropriately, so tubal factor. The pelvis needs to be without scar tissue or endometriosis, which can impair the ability of eggs to find their way and get captured by the fallopian tube. And it'll also have to be ovulating consistently, and also ovulating consistently good quality eggs. And so that's kind of the overall thing, and it kind of demystifies the whole idea of how to work with a fertility patient when patients come in. It makes more sense to them. And so when it comes to even more advanced techniques like IVF, you can take this and break it down narrow it down to 3 different things. You still have to have a healthy uterus for babies to attach, for embryos to attach. You need to have healthy embryos, which come from good quality eggs and good quality sperm. And you also have to have somebody like me be able to technically, without too much difficulty, take those embryos and be able to insert them into the uterine cavity, so do a technically easy embryo transfer. And so it's going to kind of hit on some of these factors. So again, with male factor, again, breaking it down in components, our fundamental diagnostic tool is really looking at sperm counts. We look at how many sperm there are, how many are moving, what percent motility there is. We also stain them and look at heads and tails and see what percent are normal appearing. And all those factors are concerned with how well a sperm can do its job, which is to find and fertilize an egg. If sperm parameters aren't perfect, there's some additional diagnostic things we can do. Gentlemen will go and have some laboratory drawn to look at hormonal things. We'll do a hormonal assessment. They can also have an ultrasound done to look for the presence of a dilated vein that leaves the testicle called a varicocele. And if that dilated vein is there, blood flows away slowly, metabolic byproducts build up in heat and can damage or negatively influence sperm production. Sometimes we'll send them to the urologist for even more of a thorough workup, including a physical exam. So, and what we do with sperm ultimately depends upon how many sperm that we have to work with. So that's the male part. Again, we have to have a healthy uterus for babies to grow in, and so that's our uterine factor. And the uterus is really, You changed that, but it didn't change. I'm sorry. There we go. It was changed here. Need a nice, healthy uterus for babies again to develop in. And we look at uteruses structurally and also look at them physiologically. The uterus is really just, as you can see in the picture, it's this big, thick, muscular-walled organ that has a cavity inside where babies grow. And that cavity has a lining to it called the endometrium where babies attach. Sometimes that lining can have focal overgrowths that are called polyps, and the muscle will have overgrowths that are called fibroids. And those aren't really uncommon things. At least 30% of women will have either or both of those. So we just don't want there being too many, too big, or located in a bad place where it makes it hard for implantation, or if there's implantation, it can increase the risk of miscarriage. So you have to have a nice, healthy uterus structurally. If there are problems like polyps and fibroids, we usually do surgery to correct those things. We also look at the uterus physiologically by just through really the tool of an ultrasound. We look during treatment cycles, whether someone's taking medicines for an insemination cycle or doing IVF. They always look at endometrial thickness and pattern because certain patterns and thickness correlate with better chances for implantation. To look at the uterus structurally, we can do ultrasounds. We can put water inside the uterus under ultrasound guidance, called a sonohystogram. We can put dye in there and look with an X-ray. It's called a hysterosalpingogram. And sometimes we'll actually take a peek in there with a little surgical tool called a hysteroscope to make sure things are perfect inside. So sperm have to be great. We need to make sure the uterus is a nice environment for babies to grow. And the last thing is we need to have, thank you, need to have healthy eggs combined with those sperm to make beautiful embryos. And so, again, we need consistent ovulation and consistent good quality eggs. And so we look at how we think the ovary is going to function based upon these different parameters. We look at history. In other words, how old someone is, and I'll get back to that in a second because that's critically important, but also how regular menstrual cycles are. We can look with an ultrasound. We look at the ovaries, and we look for these little cystic areas called follicles, the egg containers inside. We call those anthrofollicles or resting follicle counts. And it needs to be, if there's, we like to see 10 to 12 or so little follicles in the ovaries. The lower the numbers, the lower chance the ovaries have of responding well to medication. So historically, we take a good history. We look with an ultrasound. And also, we do some blood tests to look at how the ovaries are functioning. And normally what happens is the brain is what stimulates the ovary to grow eggs. And we can't see eggs that are too small. We can see their containers, though, and they're called follicles. So the hormone the brain releases to stimulate follicles to grow we call follicle-stimulating hormone. And the brain is always looking at the ovary to see how well it's doing. If it's not functioning very well that month, the brain will try to compensate for that by releasing additional amounts of FSH to stimulate the ovary to work. So if we look at that blood level, FSH, high levels are bad, means the ovary is struggling and needs more to try to do its job and create an egg. Lower levels are better. The other thing we look at is called anti-Mullerian hormone, and it's called AMH, and that's a hormone actually produced within the follicles that contain the eggs, within the ovary itself. And if the ovary has an abundance of healthy follicles, those levels are going to be kind of high. So we look at that pattern of low FSHs and high MHs to see how well the ovaries are functioning. So those are the things that, again, that we're going to do from our sort of Western standpoint, our sort of contemporary use of assisted reproductive techniques to try to maximize a chance for pregnancy, a healthy uterus, good ovarian reserve, healthy sperm. And so what I want to now is we'll have Andrea tell us from an Eastern standpoint, what are things that she can do to help augment or enhance those things? How can they enhance sperm function? How can she better help the uterus have a better chance for embryo implantation and uterine receptivity? How can they do things to increase ovarian reserve and increase production of eggs from a woman's ovaries? So that's how we do it, and I'm going to let Andrea speak about how they do it.
Thank you.
You're
Thank
welcome.
you for the introduction. So my name is Andrea Thorpe, and I work at Lotus Center for Integrative Medicine. We are a center that's been lucky enough to be able to be involved in a lot of research done in reproductive medicine. And the second slide that we have, is basically that research. I'm not going to go into it. It's for those who are really, really interested in knowing what's being done out there. There's a lot of research being done, and a lot of good research being done. If you would like access to it, please go to our website, and you also have copies of this to look at. But let me talk a little bit about how this integration really becomes a wonderful marriage. Chinese medicine evolved around 5,000 years ago, and it evolved from the observation of agrarian societies, farming communities, and they observed how environmental factors had an impact on physiological function in the body. And that brought a concept that nothing was working interdependently. We don't function independently of our environment. We function in an integrated way with our environment. So we really are an expression of our environment. By that same token, what's happening internally, physiologically in the body, no system, no organ system functions in isolation. There's always an integration, there's always a checks and balances, a compensation system that's going on in the body. So when one system fails, the other one compensates. And the other concept that comes is that if we are an expression of our environment, no two people are going to express it in the same way. So when your parents told you that you were special, they weren't lying to you. You're unique, you really are unique. And this is what we are trained to observe in Chinese medicine. I stress the observation side of things. It really is a medicine very, very closely based on observing how function is taking place in the body. So when we look at the at the reproductive system, I like to give an analogy of, because it's based on the study of a farming community, I like to give an analogy of plants. So you can take a genetically perfect seed, and this is the seed that Dr. Nelson's going to harvest. And you can plant it in soil. But if that soil doesn't have the right pH, if it doesn't have the right micronutrients, if there isn't enough sunlight hitting it, doesn't have the right moisture, it doesn't have the right bugs, the microbiota in the soil is not right. It doesn't matter how perfect that seed is, it's not going to flourish, it's not going to grow. And by that same token, you can take a seed, not so great, it's maybe a little bit older, and you put it in the perfect environment. Any gardener in the audience is saying, I understand this. You can put it in the perfect environment, and its genes will express, it will flourish into a wonderful plant. And I give this analogy because our purpose isn't to get patients pregnant. Our purpose in this work is to help people have healthy babies. And this is the most at the heart of what we do. So let me give you this analogy. Let me then transpose this analogy into what's happening in the body. So in the center of this slide, you have the reproductive system. And around it, you have all these other systems. And this, again, brings to mind the point that I made earlier, that nothing functions independently. Everything is interrelated. So when we come to the respiratory system, for example, well, what has that got to do with reproduction? We know that the cells in the uterus and in the ovaries have huge amounts of mitochondria. Mitochondria are the powerhouses in the cells. They create ATP, they create energy. And we know that for most physiological functions in the body, you require oxygen. Where are you getting that oxygen from? The respiratory system. So when we observe our patients and we see, or they note, they have a tendency for upper respiratory infections, they have asthma, they were smokers, we will know that there will be some compromise to that delivery system of oxygen to the reproductive system. So we address that. Let's look at the digestive system. Now we're going to start making the analogies with the farming. Micronutrients. I'd like to change that expression of you are what you eat to you are what you absorb. And we have patients who are on pristine diets. They've taken the steps to get healthy for their reproductive journey, but they're not absorbing nutrients. Those nutrients aren't getting where they need to be. And this can come from a number of different factors. You need so many different factors to be working concurrently for you to absorb the nutrients from the food that you eat. Pancreatic enzymes, acid in the stomach, bile salts, good flora in the gut. All of these components have to be working optimally for you to get the nutrition that you need for your fertility journey. The circulatory system, well, it's the vehicle that transports the nutrient and the oxygen to the uterus and to the ovaries. And this is why Chinese medicine gets really, really great, because this is where they've done a lot of research. We can use points to direct that circulation of blood directly to the uterus and to the ovaries. And this is the research that's being done. They've done it with Doppler. So how well can we, by using certain points, can we increase that microcirculation, that vascularization of the uterus and the ovaries? And we do that very, very successfully. And then let me just briefly go into the nervous system. Well, nervous system, and everybody talks about stress. And stress can mean a lot of different things. You can be stressed because you're not getting the right nutrients. You can be stressed because you've been stuck in traffic, or you can be stressed because your body's inflamed. You can be stressed because you've had 5 IVFs and they haven't been successful. So what we know from the Western medical perspective is stress shifts circulation of blood in the body goes to the extremities, away from the internal organs and out to the extremities, because we're designed to survive. We're designed to run away from that saber-toothed tiger. And in this society, in LA specifically, we're under so much stress. That circulation of blood is constantly being hampered. It isn't where we want it to be. So with the Chinese, with acupuncture, we constantly sending that message of restoring that function and guiding that circulation. And the same applies to the endocrine system. And finally, I want to talk about the detoxification system. And if you remember at the initial start of the talk, I talk about how we are a product of our environment. Just take a minute to think about the environment that we live in today, how many toxins we are exposed to. And our bodies are designed to work this out, to get rid of it, to balance things out. But if our detoxification mechanisms aren't functioning properly, and that's a function of liver and lungs and kidneys and large intestine and skin, if they're not working properly, you're going to have a toxic overload. And we know that a lot of these toxins do have endocrine disrupting effects. So basically, they disrupt our endocrine system. So what we're doing is we're balancing all these different organ systems. And we have to do that in order to maximize and restore reproductive health. So when you think about unexplained infertility, well, from our perspective, there is no such thing. We'll always find a reason what's going on, what we can tweak, what we can turn, what we can regulate in order to optimize these things. So Dr. Nelson and I, we've worked together, and we want to present a case, because everybody loves stories, and this is a really happy story. And this is a patient that we recently treated together. And Dr. Nelson, would you like to tell us what you did with this patient?
Yeah, I mean, we went through the things that I talked about. We made sure she had a healthy uterus and she had good ovarian reserve. She was 38, so she was not a fossil, but she was not a spring chicken. She's kind of somewhere in between. And her ovaries, based upon our hormonal parameters, ultrasound, things looked okay. And also, so healthy uterus, husband had good sperm. She had reasonable ovarian reserve, and we did a mock embryo transfer to make sure that the catheter would pass easily. So all the things that we do to maximize success with an IVF cycle. Responded well to medications, and she really went through 3 in vitro fertilization cycles before I finally convinced them. And they actually went kicking and screaming.
They did.
And even called me afterwards, and she wants us to do this, and she wants us to do that. And I said, I don't understand all those things, but something isn't working. We did 3 embryo transfers and put back 3 and 4 embryos each time. So we weren't messing around. And she really had no implantation at all. And so they're just, you talk about unexplained infertility. I mean, we have our parameters that we look at, and beyond that point, we are kind of lost as to where to go from a Western standpoint. That's where the term unexplained, it's about 15% of the patient population. So that's why I love this whole process, because they approach you from a whole different paradigm and deal with things that we weren't even trained to do. And like I say, everything just kind of synergizes. So I finally got them to go see Andrea, and then
they came in, and the wife didn't speak English, and the husband translated. So I gave him the analogy of the seed. I told him, look, what's going on with your wife is she's not absorbing nutrients. Her digestive system is in very bad shape. And by that token, her circulatory system is also impacted. And she has what we term in Chinese medicine a cold womb. Basically, there's not enough nutrients, not enough warmth, not enough circulation to the uterus. But it's not just going to be fixed by doing acupuncture alone. We have to do this. Anyway, there was a huge giant guffaw at that point. And so I sent them off. I said, okay, let's go and do some functional medical testing, and we check people's nutritional status. And I said, if I'm wrong, that nutritional status of your wife's will come back perfectly. And we also did a stool analysis because, again, the microflora, the microbiota of the ground, and she came back and she was basically completely deficient in B complex, no CoQ10 in her system, high needs for CoQ10, which is your main antioxidant. It's being used tremendously now in the fertility world. And she was plagued with parasites, yeast in the gut. So we got started, we got cracking, and we gave her herbs, and we gave her diet, and we administered acupuncture once a week. And the point I want to make with all of this is that it wasn't a short, sharp process. We worked together for 6 months. What happened in the 6 months, she came in weekly and then bi-weekly, is that she actually ovulated, and this woman did not ovulate. She hadn't ovulated for many, many years, and she ovulated twice, which really got them excited. But after 6 months, and because she wasn't a fossil, but was
that's our tension too, in that we're always kind of balancing age, and age is not necessarily your friend when it comes to reproduction.
Right.
And so whenever I send patients to Andrea or to the Lotus Center, I always tell them you need to go there because they'll say, when are we going to start again, or when are we going to get going? And so you need to talk to them first because it's unusual you're going to be seeing them and they're going to do their diagnostic things and say that you're all tuned up and you're ready to go. It may take anywhere from a month to usually not 6, but
it was
a long time. And so it's just kind of stressed me out a bit, speaking of stress, because, like I say, the clock was ticking. So we always have to try to find that balance between letting too much time pass and, getting things optimized.
Yeah, so we sent her back to Dr. Nelson after 6 months,
and we basically did the same thing. We, did IVF. She responded the same. We have nice embryos transferred, and lo and behold, this time she's pregnant. And so, that's extremely anecdotal. I get that, but that's not the one occasion it's happened. There's been multiple occasions where we just are sort of at our limit as to what it is that we can do. And like I say, their approach is totally different and completely synergizes with what we're doing. I'm sorry.
I was just going to say, I think that's a prime example, though, of restoring your health to optimize the fertility. And that's, my menstrual cycles were between 20 and 42 days. Very difficult to be ovulating on a regular, consistent. So once we got that fixed, my IVF cycles just seemed so much easier afterwards, and the ability to care for the patient. So I think it's about optimizing their health. Fantastic.
And I think the fundamental thing too is, as doctors, we, out of convenience, separate the body into organ systems. Cardiologists work with the heart, gastroenterologists with the stomach, we do the reproductive system. But the reality is everything really is functioning together. And so everything has to be optimized regarding your health. Nothing replaces nutrition. Nothing replaces good. You have to, the more optimal you can be and your overall well-being enhanced, the better everything else is going to work, including your chance of conceiving. And the thing about CoQ10, there's all these things, I don't know if you want to, but there's all these sort of magic things out there that everybody kind of grabs onto and starts to take. But if your body's already has an adequate amount of those things, Andrea can speak to this better than I can, but if you take more of it, it's not going to make things better, it's going to make things worse. And so it's not as simple as going out and getting the latest, greatest thing that's out there. It has to be balanced in accordance with what's happening with you as an individual.
Right, and as a practice, we do practice a lot of functional medicine, so we go out, we send people out to be tested for their nutritional status before we give any recommendations on supplementation. And as a practice, generally, there really is no substitute for a good diet. There is no substitute. These compounds are usually synthetic. These supplements are usually synthetic. You have an absorption issue with these things. Food is your best medicine, and food is the medicine that you're going to be taking every day. So we coach our patients. We're all board certified in nutrition, Chinese nutrition. We coach our patients individually. And so the other thing is, what's that expression? What's poison for one man is what's gold for one. Anyway, what's good for you is not necessarily. So there's no fixed diet.
Right,
this is the diet for fertility. It's going to be different for each person depending on which organ system needs to be addressed. We may be telling somebody to eat more radish and somebody else to eat more Asian pears. It just depends on what is presenting, and this is what we are trained to look at constantly. And the other thing that happens is that this isn't fixed, it's not static, it's moving. Body's evolving, people are evolving, and this is a journey that we work with together.
As an underscore to the whole environmental thing, we have a lot of patients coming from mainland China now, and it's unbelievable how horribly their ovaries respond, because just all the toxins that they're getting exposed to in their environment. Young women are just acting more like they're 41, 42, and that's because of the things they're breathing and they're taking in.
Right.
So.
Yeah, I'm a big fan. So at this time, I'd like to be able to open up for questions that the audience. I know I have my questions, but if anybody has any questions, I'm happy to take those. All right.
We're gonna make her the official question taker.
How do you know if your body is got toxins? And is there a test or? that if you do, or?
Yeah, you can do a number of different tests, but we also do it diagnostically to see how the organ systems that are in charge of detoxification are faring, so if there's stress in those organ systems, and we do that through our diagnostic techniques of feeling pulses and looking at tongues. So we can tell, for example, if somebody's liver is a little bit congested or if their lungs aren't functioning optimally. So you can, we definitely send out people to have...
Is that done with blood tests?
You can do it with blood, with urine, hair analysis. There are a number of different things that you can do. There's a urine test is the one that's most commonly used. You use a chelating agent and pee in a pot and then send it off. It tells you what you had in the system there.
Pee in a pot.
Pee in a pot, sorry. Very technical language you use here.
That was a cup.
That was a great speech, very informative, and I thought I knew a lot about infertility, but I learned something today. So thank you, both of you. My question, Dr. Nelson, is IVF is expensive.
Right.
It starts at least by $15,000, and we're going up from there. So when you do a workup on infertility patients, why don't we start with doing some of these tests? So instead of them going into IVF, we take the first 2 or 3 months and make sure that they balance just as a norm in our field, and we know what's wrong with us instead of $45,000, $50,000, $60,000 later in 3 IVF cycles, and now I'm exhausted and I think I'm never going to have a kid. Now I'm being told that my body's not balanced.
That's a great idea. And the problem is, and I've experienced this too because I'm an osteopathic physician. So when my medical school trained me not only in things that MDs learn, but I also learned a very strong background on the musculoskeletal system. And it's amazing the treatments that DOs that just work with their hands are doing to normalize people's structure and function. Yet, when I would mix into the MD world and go to hospitals for my rotations and things and meet orthopedic surgeons and people that did structural things, they said that stuff is all a bunch of bunk because they weren't trained in it. It didn't have any validity to it. And a lot of people, I think, look at Eastern medicine the same way. I just don't think because they didn't learn it, they don't understand it, it doesn't have any validity to it. And Andrea can speak probably better to that, but I think you're right. I think there's all these disciplines out there that we all have our own degrees of success. And if we could somehow put them all, somehow lump them together in one magic form of medicine, we'd really optimize people's overall health. So no, you're right, they should. I mean, there's, if things are broken, then it's very hard to work with. So that's why I send more and more people to these guys.
Right, and we do have a collaboration whereby Dr. Nelson, we communicate and he'll say, is this one ready? We'll bounce back, and we do this quite a bit, where they'll go for their initial assessment and he'll run his tests, and if he sees that something is amiss from his perspective, he'll send them to us before they've undergone IVF. So that really is basically an integration. From our perspective as professionals, we have to create establish those relationships.
And also, despite recommending it to patients, some patients just don't want to go.
Right.
It's like not like these guys are cheap either. And so I don't know how the insurances work, but I have a lot of complaints about I've got to go 2 times a week, 3 times a week, and so it's adding an additional expense, and so it just all kind of compounds, and so. No, Karen, I get it, but it's just hard to talk people into it. Yep.
But what I'm saying is when no one said to me, we're taking your FSH and all your other...
Right.
Thanks, yeah. We're taking your FSH and all these other levels. By the way, we're going to spend an extra $600 and we're going to run all these hormones just so you know that they might not be balanced or they might be balanced. And you don't have to go, but I have the knowledge from day one that I can go ahead and do IVF, but you always warned me that these things are not correct, versus 3 cycles later.
Right. Well, that's personally, that's what I do.
Oh, great.
I try to get them as quickly as I can. But some people just don't want to go, and they take sometimes a cycle or 2 of failure and say, well, what can I do now? And I'll say, well, we talked about this before. Maybe now's time to go do that.
Are there any, Andrea, are there any particular symptoms? So if the doctor says, do you often have indigestion? Do you often have heartburn? Those are symptoms. If you give us some suggestions that are pretty typical in the population, that you could say, well, have you ever suffered, do you suffer frequently from heartburn? And if the patient says yes, you can say, well, I just want you to know that's probably affecting your infertility. I'm just giving you a random idea. I know nothing about your field, but are there some suggestions you can give us, some things that we might experience regularly, like you've always got dry skin, therefore this is probably a concern for you?
Gosh, that's a very
Is
hard,
it too broad?
It's such a hard question to try and pin. I mean, I could put it, say, for example, in relation to stress. There are so many, it's so multifactorial. combinatorial.
I think when you mention the word stress, as a working woman, I immediately think, oh, great, so now you're blaming me because I work every day. I mean, the word stress is like a trigger and it makes a woman angry because, oh, great, now you've made it my problem. So I found that the word stress is like, oh, great, now it's my fault that I have to go to work every day.
No, thank you. Yeah, I don't know. I was an infertility patient for a long time without insurance, 15 years. And I remember going to counseling and saying, I'm stressed. Could that be impacting me? And yeah, there are some physiological things that it can do. But the counselor reassured me. She said, people get pregnant in war zones.
Absolutely.
And, you know, those in some of the most stressful situations in the world, people are still conceiving. Absolutely. So don't put it on yourself for working, you know, it.
And stress is a very broad terminology. It
Yes.
really can mean a lot of different things. And like I said earlier, you can be stressed because you're not getting the right nutrients into your system. You can be stressed because you've eaten a plate of pasta and you're gluten intolerant. There are so many different factors that are determining what stress is within the body. But if you wanted to give it a term, it's producing an upregulation of certain functions that will create a disharmony. And then each individual is going to express it differently. That's why I was a little thrown by your question, because there isn't one particular thing that I can say, oh, well, yes, if you have headaches on this side of your head, it means that you have a hormone. Well, you can say you have hormonal headaches, for example. But it's just so individual, and it's vast, it's manic.
Thank you. So, and I'm going to ask you to use this only because it's filmed. So.
Okay. What about fibroids? Do you have an answer for if you could keep producing fibroids and that impedes with the IVF process?
Is that for Dr. Nelson or for me?
Well, Dr. Nelson, I mean, what do you do for fibroids if they keep reappearing? I mean, you know.
Well, go ahead. I'll answer that. But I'm just curious what you do for
that-
fibroids.
I want a question.
Okay.
Would that Chinese medicine help the fibroids from stop growing, or is there
Yes.
anything you can do to stop them
Yes,
from growing?
so we work with fibroids in two ways. If they're above a certain size, and again we have this time factor, we generally send off above a certain size, so above 2 to 3 centimeters, we'll say, okay, you need to go and see your RA, you need to go and see your fibroid specialist. But if they're smaller than that, we can do two different things. One is we give herbs to break the fibroids down, and two is the formation of fibroids is a very sophisticated mechanism that the body has of shunting excesses away from internal organs and into the uterus. The uterus is not a vital organ. The uterus is sort of sitting there. And so within the Chinese
Don't
medical
say that.
system, I shouldn't say that, was terrible. It isn't just sitting there. Anyway.
I'm just saying, does Chinese medicine, could they help them not?
So yes, so this is the point I'm trying to make, is that we can regulate that shunting system, we can regulate that dumping system by opening other portals of detoxification in the body to then help that process stop. So not only can we break them down, but we can stop the mechanism that's producing them in the first place. But again, that's within the context of them being a certain size. Above 3 centimeters, we generally send off to a specialist.
And for yeah, that's what we do. And so I mean, fibroids get blamed. The fibroids can become the great scapegoat for everything. They get blamed for everything, and so they're rarely responsible for things they get blamed for. And at least 30% of women have fibroids, and they always start in the muscle of the uterus. And we just don't want them being anywhere near compressing, somehow deviating, distorting the uterine cavity. If they are, then they're going to make it harder for babies to attach, and if they implant, they could increase the risk of miscarriage. So we just we kind of map the uterus with an ultrasound, looking for number, size, and location, and then we can pick which ones we think are clinically relevant. But if they're clinically relevant, they're generally removed from some sort of surgical technique.
And some women can see perfectly well with fibroids because they're not causing distortion to the uterine cavity, and they're not in the lining, so they're not causing inflammation and heavy bleeding, and they go on to have perfectly healthy pregnancies.
Yeah.
Okay, Dr. Nelson, you mentioned before that the egg quality is a major factor in conception, and I wanted to know how you assess egg quality. And then, Andrea, I saw on your Chinese research that Eastern approaches can improve egg quality, and I was wondering if you could talk a little bit more about that research.
I'm glad you brought up, because I meant to mention that earlier, so that's great. And so we mean, we look at a couple of things. One is how well we think ovaries are going to respond to medication to generate eggs, and the other is egg quality. And so we look at how well we think they're going to respond to medication by the things I mentioned: age, so historical things, regularity of menstrual cycles, laboratory values like the FSH and AMH, also looking with an ultrasound doing antral follicle counts. That kind of tells us how we should individually determine a treatment protocol for that patient based upon those factors. But the quality is primarily a function of age, and as you get older, there's a greater chance, and men make new sperm all the time. Women are given a certain allotment of eggs when they're born, and they get used up over time, and every egg has 46 chromosomes inside. There's 23 identical pairs, half came from mom and half came from dad. But when you release an egg, when you ovulate, the egg has to get rid of half of those chromosomes before ovulation occurs. And so they all line up right at ovulation. They're 23 pairs. Half get bundled up, they get pushed out, and the egg gets released. As you get older, though, the machinery in the follicle, in the egg, doesn't work as good as it used to, and too many chromosomes are pulled away, or too many are left behind. And a classic example is with Down syndrome. All the chromosomes line up, they all get pulled away, but chromosome pair 21 decide they're going to stay together. And so when the egg is released, there's now 24 chromosomes, not 23. Sperm being there 23, now there's 47, and that one extra chromosome caused all the problems that are associated with Downs. And so that can happen with any or all of the chromosomes and multiple at one time. And embryos with abnormal numbers of chromosomes, we call them aneuploid embryos, and they usually don't implant, or if they do, they miscarry early. But that's primarily a function of age. So when I talk about quality, I'm talking about usually genetic competence of the eggs. And it starts subtly happening, this increased risk of chromosomal problems when you're about 31. It starts rising more dramatically after age 35. And I actually looked at 500 embryos that all came from egg donors, and there were 42% on average that had chromosomal problems. So even in women who are in their mid-20s, 40% of their embryos were chromosomally abnormal. And that's why we think about 70% of pregnancies are lost before someone even misses their period, because we're making a lot of bad chromosomal embryos. And if you're 45, you're going to have probably 9 out of 10 embryos that are chromosomally not okay. So.
And the way we address the matter is how I've explained today, ensuring that you have the right nutrients that are feeding that whole reproductive area, that you're having the right amount of oxygen, and basically that the environment in which that follicular genesis is taking place, so that development of those embryos is optimal for the gene expression that Dr. Nelson is referring to. So again, it's optimizing the environment in which that follicle is developing, and then later on it's optimizing the environment in which that implantation takes place and the embryo starts to grow. So it's a multifactorial thing. So addressing the environment in which that egg finds itself, it doesn't do anything about the age, but it does influence that expression, that gene expression of the egg, and that's how we do it.
We have time for another. Oh, geez, we have lots of questions. We'll try have brief responses.
Oh, okay.
I'll keep it brief.
Is that a hint?
I'm wondering if there's a happy marriage between Eastern and Western for those of us that have structural damage, especially lower back, S1, L5 damage, pre and post pregnancy. If you'll work together with patients that might experience massive amounts of back issues.
Well, if there's anything that Chinese medicine goes undisputed as to its benefits, is in musculoskeletal issues. That's how Chinese medicine started to be introduced in the West, was basically its management of pain. And that's where most of the studies have taken place. So when it comes to structural issues, pain management, there really isn't anything quite like it. We address those because we're working with a system of channels and meridians, and those channels and meridians are communicating internal organs with the outer parts of the body. They serve as an interface. And what we do when you're seeing musculoskeletal problems, you're seeing congestion, you're seeing inflammation, you're seeing a structural shift in the body that's then creating these other physiological responses, and acupuncture will help to regulate that and will totally regulate that. So we actually treat most of our patients through their pregnancies and go on to treat them postpartum. Because when you think about it, the principles on which the medicine is based can be applied to every aspect of this journey. We even treat the children because it's the physiology, the model can be applied to every aspect of health at every age and every phase of development.
And really quickly, there's also, I mentioned, there's a lot of doctors who are very good with their hands, and they're very good with musculoskeletal medicine. So, I mean, simply with pregnancy, there's such a dynamic shift in your center of gravity that there's a lot of structural changes that occur as a consequence of that. And so there's a lot of very, mild techniques that can be utilized to normalize your structure as well and make those things better. So again, probably a combination of the two things is great.
Thank you.
Hi, Andrea. Was wondering how or does acupuncture or Chinese medicine work for the male infertility?
Well, if any of you have ever been to China, it's a nation that is all about reproduction. It's all about the proliferation of that population. My first trip there, they were just handing us the enhancers, the male enhancers. But basically, the heart of Chinese medicine when it comes to male reproduction is the use of medicinals, of herbs. And these herbs have a number of different functions. One we know is inflammatory responses within the body can affect the quality of sperm, circulatory issues, so what Dr. Nelson was referring to earlier of hydrocele or varicocele will affect the quality of male factor. And those herbs and acupuncture as well will serve, again, we're pinpointing this microcirculation of blood and this drawing of nutrients and this elimination of byproducts of inflammation from that area, and it's very, very specific. So you have within the Chinese pharmacopoeia, within the herbal medicine, you have at least 300 herbs that are used to enhance male fertility. And again, you have a number of different potential factors that are causing it, and we use our own diagnostic techniques. So we use things like having, weak kidneys or poor young energy, for example. So there's very little mobility or motility going on in the sperm. And so we use medicinals according to what the presentation is.
Thank you. One last brief question, because we're actually over a little bit.
I just was wondering if you could speak real quickly to what steps you might have for somebody that does shift work. Me and my wife are both nurses. We work the graveyard shift, so I know that does have some effects, but something that you could offer that kind of speaks to those, to where, unfortunately, we know those are stresses that are in our body, but what we could do to maybe help that.
Right. Yeah, that's a hard one. Again, it's all about how you respond to that environment as an individual. So we know that working night shifts is incredibly stressful for the body in so many different ways, and can produce hormonal dysregulation in the body. But if you're working on this theory that I presented today, you can regulate it. To what extent? That would be dependent on each individual, but you're working with a system that's a regulatory system, so we're there to restore harmonious function. So I actually did work with a patient who was a nurse who worked night shifts. It was challenging. Again, it just depends on the individual, but we do work by regulating that hormonal secretion and then the nervous system and how that's impacted by that work schedule.
So more of it coming in and doing the function or the diagnosis approach and then addressing
it really is at the heart of it. We can't just say, oh, take this, take melatonin. There's so much more to it.
Thank you both so much. And because we're short on time, I'm going to read our thank yous, but there is not a lack of sincerity. Thank you to the speakers. Thank you both so much for your expertise and your time. Please show a hand if you've learned anything about the importance of restoring your health. I mean, really, it's fabulous. You can watch all of the videos of the sessions on Fertility website soon, free. They're free. You can watch all of them. Follow on Fertility Planet, Twitter, Facebook. Get lots of great information. Thank you to Fora.tv for live streaming and recording these programs. Thank you to the sponsors, HRC Fertility, Lotus Center for Integrative Medicine. Thank you very much for doing this session on restoring health to optimize fertility. Thank you all for joining and participating. If you want to learn more about the doctors or any of the speakers, fertilityplanet.com. There are also opportunities to book appointments with experts while you're here or this weekend. So
Can I do a shameless plug?
please.
Okay. There's a young lady, Wendy, in the back. She's from our office, and so if anybody would want to, Wendy has vouchers here. So if anybody wants a free consultation, they're more than happy to have you come to our office and sit down and talk about your individual circumstances and see if we can help.
That's just
Okay.
Shameless plug on my side. There's Paulina at the back. She's holding her hand up there. We're offering exactly the same
Okay,
service.
I'm getting in on this. Fertility Within Reach offers free coaching to patients who don't have insurance benefits, and we help you figure out how you can get insurance coverage.
Wonderful.
So we're all plugged.
Yay, we're all shameless.